Signs of a stroke. 24 hours before the attack, learn them and save your life. What is a stroke? A stroke happens when blood flow to the brain is interrupted, causing brain cells to begin dying within minutes. It is a medical emergency that requires immediate treatment. The faster a stroke is treated, the greater the chance of reducing brain damage and saving a person's life. There are two main types of stroke. Ischemic stroke, caused by a blockage in a blood vessel supplying the brain. Hemorrhagic stroke, caused by a ruptured blood vessel in the brain. Many people believe strokes happen suddenly without warning. However, in many cases, the body actually gives warning signs several hours, even up to 24 hours, before a major stroke occurs. Signs of a stroke. 24 hours before the attack, early warnings you should never ignore. Many people mistake early stroke symptoms for fatigue, stress, lack of sleep, or minor illness. Recognizing these warning signs early can help someone get emergency treatment faster, improving survival and reducing the risk of permanent brain damage.
1. Numbness or tingling on one side of the body. One of the most common early warning signs is sudden numbness, tingling, loss of sensation, sudden weakness. This usually affects only one side of the body, such as one side of the face, one arm, one leg.
Some people notice they suddenly have trouble gripping objects or feel heaviness in one leg while walking. This happens because blood flow to certain parts of the brain becomes disrupted, affecting nerve function. What makes this dangerous is that the symptoms may last only a few minutes and then disappear, causing people to ignore them. In reality, this can be an early warning of a major stroke. 2. Facial drooping. Hours before a stroke, facial muscles may begin to weaken. Common signs include uneven smile, one corner of the mouth drooping, heavy eyelid, drooling. Sometimes family members notice these changes before the person experiencing them does. This occurs because the area of the brain controlling facial muscles is losing blood supply. 3. Slurred speech or difficulty speaking. A stroke can affect the language centers of the brain. A person may suddenly speak unclearly, struggle to pronounce words, use incorrect words, feel confused while speaking, have trouble understanding others. Some people say their thoughts feel clear, but the words simply won't come out properly. In early stages, speech problems may disappear after a short time. This can be a sign of a mini stroke, which should never be ignored. 4. Sudden and unusual. Severe headache. A stroke-related headache is often very different from a normal headache. Common characteristics: sudden onset, extremely intense pain, sharp or heavy sensation, nausea or vomiting, does not improve with rest. In hemorrhagic strokes, the headache may feel so severe that it is described as the worst headache of my life. If a sudden headache appears together with weakness or slurred speech, seek emergency medical attention immediately. 5. Sudden blurred or darkened vision. The brain also controls vision. When blood flow is interrupted, a person may experience blurred vision, double vision, temporary vision loss, difficulty focusing. Sometimes only one eye is affected. Some people describe it as a dark shadow or curtain covering part of their vision for several minutes. These symptoms may come and go before a major stroke occurs. 6. severe dizziness and loss of balance. Someone about to experience a stroke may suddenly struggle to stand steadily, walk unsteadily, lose coordination, feel the room spinning. This is more common when the stroke affects the cerebellum, the part of the brain responsible for balance and coordination. Because these symptoms resemble vertigo or exhaustion, many people underestimate them. 7. Sudden extreme fatigue. Some stroke patients report overwhelming fatigue hours before the attack. This is not ordinary tiredness, but rather extreme body weakness, sudden loss of energy, difficulty concentrating, simple activities feeling exhausting. This may happen because the brain is no longer receiving enough oxygen and nutrients. 8. Confusion and difficulty focusing. Stroke can affect thinking and information processing abilities. Warning signs include sudden confusion, trouble understanding conversations, forgetfulness, slower responses, appearing mentally foggy or disoriented. Sometimes the person may seem absent-minded or unaware of their surroundings. 9. Mini stroke, TIA, a serious warning sign. Many major strokes are preceded by a transient ischemic attack, TIA, also known as a mini stroke. A TIA occurs when blood flow to the brain is temporarily blocked and then restored. Symptoms are similar to a stroke: numbness, slurred speech, blurred vision, weakness on one side. However, the symptoms usually disappear within minutes or hours. Because the symptoms go away on their own, many people never seek medical help. But a TIA is a major warning sign that a full stroke could happen soon. Why fast treatment matters. During a stroke, millions of brain cells can die every minute. The faster treatment is provided, the greater the chance of survival. The lower the risk of paralysis, the better the chance of recovery. Never wait for symptoms to go away on their own. Easy way to remember stroke symptoms. Fast, use the FAST method. F. Face. One side of the face droops. A. Arm. One arm becomes weak or numb. S. Speech. Speech becomes slurred or difficult. T. Time. Time to call emergency medical services immediately.